Good morning, our student. How do you do? Precisely, we have studied both types of nematodal parasite that dwell liver and lung in the preceding lectures. Today we will talk about other different species of nematodal parasite that can infect our GI, gastrointestinal tract. Today we have two species. Now, about the intestinal flak. The first species here is Meteorogonist yakagawa, as a scientific name, Meteorogonist yakagawa. Its common name, heterophyte flux, and can cause metagonomiosis. Now, about its morphological feature of the adult worm. This parasite is a smallest flak. Here, a smallest flux is Meteorogonist yakagawa. To affect human and other mammals such as cat, dog, and pig. The worm is piriform in shape, with tapering occurring at the anterior end and surrounding at the posterior end. Okay, a thin layer of scaly spines cover the organism, which is heavily distributed over the anterior end. This parasite can live in the small intestine, as we mentioned before, of the definitive host, we mean human and other mammals, can be found within its GI, at the villi. Now, the ventral suckers is characteristically deflected to the right, with its long axis in the diagonal plane. Other slide. Now here also this slide can show you other criteria pertaining to Meteorogonist yakagawa. Now about its distribution, geographical distribution, it's in Far East. Location of the adult and the final host is small intestine. Shape of over. The shape of over of this parasite is prominent opercular. It is operculated, having shoulder with yellow or bile stained color. Now, how infection can occur? Infection is acquired by eating raw or pickled fish, the second intermediate host. Now, about its symptoms, occasionally diarrhea and vomiting. Other slide. Now this slide can show you the morphological form of stained slides of Meteorogonist yakagawa, the smallest nematodal flak. On the left, stained slide, and of the adult worm stained with the carmine stain, whereas at the right side of the slide we can see the adult stained, and also can see the egg, two stages, up the adult worm and beneath it the egg stage. Other slide. This slide deals with the egg. This egg is consisting with a developing menocytome. So the egg, when be hatched, it having developed, embryonated. We mean it's embryonated, not unembryonated like that studied preceded in preceded lectures. So it consists of developing menocytome and except an operculum. Yeah, it is operculated. Now, it is resemble that of Clinorchus sinensis and Paraganimous wisselmanii, but can be confused and indistinguishable There are only two somewhat discrete differences among the egg of Heterophis and Meteorogonist Yakagawa versus or opposite those of Chronological Sciences. Here is very important criteria. Two differences that can resemble the egg of Heterophis and Meteorogonist Yakagawa, which is different from that found in the Chronological Sciences. The first is the Heterophis and Meteorogonist eggs have shoulders. Okay, it's half shoulder like that. But they are with less distinct than those of Chronological. The first difference. Second, the eggs of Heterophis and Meteorogonist may lack the small terminal lobe found in those of Chronological. Sometime or may lack, not prominent, may lack, cannot be void. Okay. This slide can show you the life cycle of the Meteorogonist Yakagawa. Now, human infection as a definitive host and other mammals can be infected. How the infection can occur of both Heterophis and Meteorogonist Yakagawa can occur after ingestion of metacercaria present in raw or contaminated undercooked fish. The second, intermediate hosts that harboring or infected by these parasitic pathogen. After ingestion, the infection can occur. The adult worms of both species reside in the small intestine, in our GI, the general region, especially. The mollusks and fish are the first and second intermediate host, respectively. Now the cercaria has a lateral floating tail. Okay. Other slide. Now here we can see the life cycle presented clearly here. Now in this shape we can see a whole life cycle which is similar of both Meteorogonist Yakagawa and Heterophis. Both species can dwell and effect present the adult worm can present in our GI, and the life cycle is similar, so similar, resembled. Now, on the right side of this slide, we can see the human how can be infected. Now, the human, we mean host, human or mammals, become infected by ingesting undercooked fish containing metacercaria. Now, the metacercaria exist in the small intestine, and then the adult will be formed in our small intestine, the adult worm. The adult worm can give what? Can give embryonated egg, not an embryonated, but embryonated egg with its fully developed miracidium are passed in feces from human and from mammals, fish-eating mammals and bears. Now the embryonated egg can have two miracidium. The miracidium can enter the first intermediate host, which is a snail. So the snail host ingests egg. Miracidium emerge from the eggs and penetrate the snail intestine. Now undergo several developmental stages: sporocyst, stridea, then cercaria. Now the formed cercaria will be secreted out or excreted out from the first intermediate host to be free in water. Now, then it will search about second intermediate host, which is fishes. The cercaria will penetrate the skin of a fresh brackish water fish and insist as a metacercaria. Now form to metacercaria and the tissue of the fish, the second intermediate host, and the human and the animal come again to ingest such undercooked fish containing metacercaria to be infected. So the life cycle will be continued in this wise. Now about its pathogenicity. The egg of this parasite is very important criteria. The egg of this parasite have the ability to escape in the lymphatic and venous via intestinal wall filtration and to migrate to other area of the body such as heart and brain. Now granulomas in this area often result. Granulomas or calcification can occur in this ectopic sites. Well, about its clinical symptoms, two phases, asymptomatic and symptomatic. The asymptomatic, we can say light infection, typically remain asymptomatic. The patient, the affected individual cannot be symptomized, not suffering from symptoms, not appear to be symptomized. Whereas in symptomatic or metagonomiasis as a disease, heavy infection, in heavy infection of Metagonomus yakagawa produce abdominal pain and discomfort. Patient often experience a chronic mucus diarrhea and eosinophilia. It causes a catarrhal condition of intestinal and diarrhea. Well, another slide here can show you how can we diagnose it in laboratory and how can we treat it eventually. Now, laboratory diagnosis is, or it can be made by recovering the egg in stool samples. This is difficult. Very important criteria. This is difficult to achieve. Why? Maybe you ask yourself why it is difficult. Because the reason is because the egg of both heterophis and Metagonomus yakagawa and clonocal sciences are so similar to each other. Okay. Now, about its treatment. Now, the treatment of choice for Metagonomus infection is the praziquantel drug. Well, we will change or deal with other species in the lecture of today, which is heterophis.